Do you suffer from regular heartburn and acid indigestion? Have a sore throat along with a difficulty in swallowing food? Then you may be suffering from gastroesophageal reflux disease. Gastroesophageal reflux disease, or GERD, is a condition whereby stomach content, acid, and food flow back or reflux into the esophagus, damaging and irritating the esophageal lining and resulting in a burning sensation in the throat. The reason for this is a weakened lower esophageal sphincter, which relaxes inappropriately when food is being digested and churned in the stomach, causing food to move into the esophagus. So, how do I know if I have GERD? Well, GERD signs and symptoms include a burning sensation in your chest or heartburn, sometimes spreading to your throat, along with a sour taste in your mouth, chest pain, difficulty swallowing, dry cough, hoarseness or sore throat, regurgitation of food or sour liquid, which is acid reflux, along with a sensation of a lump in your throat. If you experience these symptoms 2 or more times in a week, you should consult your doctor to seek treatment. There are many causes for the weakening of the lower esophageal sphincter. Hiatal hernia, a condition where the upper part of the stomach has moved above the hiatal ring, which is the hole in the diaphragm through which the esophagus passes, can cause this as well. This weakens the LES's contractions. Also, when the LES is displaced away from the hiatal ring, the LES and the hiatal ring now exert separate, weaker pressure on the esophagus, allowing food to reflux easily. Abnormal esophageal contractions can also worsen effects of GERD, since acid that is reflux cannot be pushed back down into the stomach effectively via peristalsis. Recent studies have also found that smoking relaxes the LES. Hence, one can stop smoking to prevent further relaxation of LES and reduce GERD symptoms. If you do have GERD, reduce consumption of tangy citrus-rich foods such as tomato, orange, lemon, grapefruit, etc., especially on an empty stomach. This is because if the contents reflux into the esophagus, the increase in acidity along with hydrochloric acid in the stomach can cause further damage to your esophageal lining. Do also refrain from eating chocolate, drinking coffee, or any food with a high caffeine content. This is because ingesting cocoa can cause a surge of serotonin. This surge can cause your esophageal sphincter to relax and gastric contents to rise. Caffeine and theobromine in chocolate may also trigger acid reflux. It is advised that you eat at least 2 to 3 hours before sleeping or lying down, such that it is more difficult for acid to reflux due to the influence of gravity. One treatment for GERD is the use of over-the-counter medication, which can be used to either relieve heartburn or to reduce the effects of heartburn. For example, antacids such as Melox, Mylanta, Gelusil, Gaviscon, Rolaids, and Tums can neutralize stomach acids that reflux. This, however, only provides temporary relief, and overconsumption can have side effects like diarrhea or constipation. For a long-term solution, use medications that block acid production and heal the esophagus. Proton pump inhibitors are competitive inhibitors that attach to active sites of enzymes in the stomach that produce acid, reducing amount of acid produced and allows time for damaged esophageal tissue to heal. Over-the-counter protein pump inhibitors include lansoprazole and omeprazole. In very rare cases, medication to suppress symptoms of GERD may not be effective. In that case, surgery is recommended. A procedure known as fundoplication. This procedure first pushes the hiatal hernia below the diaphragm and stitches it in place. In addition, the hiatal ring is also tightened and the stomach is wrapped around the lower esophagus to make an artificial LES. This increases pressure exerted on the esophagus when food is in the stomach, preventing reflux. In recent years, endoscopic treatments have also been developed, which uses radiofrequency waves, injection of materials, and many other techniques to tighten the LES. Whichever way you treat GERD, it is important to note that GERD is a chronic illness, and most of these treatments require regular application. GERD, if left untreated, can lead to esophageal a chronic condition where there is permanent damage to the esophageal lining. It is therefore important to take action immediately and work towards a healthier and happier Singapore.